of the perks of being a vascular surgeon is that we're really able to offer our patients comprehensive vascular care. And what that means is for any disease pathology that a patient shows up with, the therapeutic options can range from just medical management all the way up to open surgery. As vascular surgeons, we're kind of well suited to work with the patient to figure out what's best suited for them, their preferences, their desires, their needs, and their goals. Oftentimes, patients come to you with a disease that no one really knows how to help them with. We'll be able to recognize what disease process they have, either be arterial disease or venous disease, order them the right tests to figure out exactly what's going on, and then give them a therapy that will finally address the issue that they've may be having for weeks to months, and some patients even years, and finally they feel a relief for their symptoms. Or even for some patients, just getting that diagnosis. We may not be able to do something, but sometimes explaining to them why they're having the symptoms they're having, or telling them that there's other patients like them, really that's very satisfying, kind of answering some of those questions for those patients.